This is Dr. Mitch Freeman, board certified family doctor. This video is requested by a local family nurse practitioner. Common cold, very old age question. What's important to understand common cold is not everyone is the same. So I'm going to divide it to a normal person, someone with mild allergy, someone with like bad asthma and allergy. So a person with a normal person that has no allergies, no asthma, most of those people, they get better on their own with a cold. They really don't need to do anything. Like if I get a cold, I'm from that category. I don't need to do anything. But if you want to do something, if you have like aches and pain, you can take Tylenol, or my preferred is Aleve 2 twice a day with food. Aleve, 2 pills twice a day with food. That's for the ache and pain. For the sinus congestion, I would use Sudafed behind the counter, and I would run a vaporizer or humidifier at bedtime. If you're a person that have mild allergy or mild asthma, typically you're going to end up having the cold that lingers longer than usual. You can do Sudafed. I would do ibuprofen or Aleve. Like I prefer Aleve 2 twice a day with food. I would run a vaporizer or humidifier at bedtime. What I do my own self with my kids and my families, we have a nebulizer we use. There's 2 medicines I put in the nebulizer. I would put them twice a day with a mask, breathe it in and out. Actually, that is more effective and cheaper than over-the-counter medication, over-the-counter cold and flu medicines. It's budesonide twice a day, and Duanep, which is a combination of albuterol and ipratropium together. I would do it twice a day. These are both prescription medicines. You have to ask your doctor to get it. I have them at home for my kids. Whenever they get a cold, the minute they have congestion, they start doing it. And a lot of time they do it for a few days and they're all good. They don't need any more medicine. They don't need to take any more antibiotics or steroid, and they will be fine. Category of people with mild asthma and allergy. Now, the third category I call that people with bad asthma, allergy, or COPD. Those people, you really need to start prescription medicine right away. I would start with prednisone or dexamethasone. I would do usually 5 days and combine it with antibiotics. I use either Cefdinir, Bactrim, or Levaquin. Depending on the person, depending how bad their condition is. But you really have to do steroid. Otherwise, your inflammation will linger. It could go to worse wheezing, worse COPD. You could end up in the hospital. You can end up, the symptoms could linger for weeks and months. But if you hit it at the very beginning aggressively with steroid and antibiotics, in addition to the nebulizer medicine, which is I use the budesonide, and the Duanep, which is a combination of ipratropium and albuterol together, that will help from the very beginning, and not wait until you're worse and then you start doing the medicine. Then you might end up in the hospital.